A lot of times in life, there's stressors that we might have. And stress in general is not a bad thing. Sometimes stress can be protective. It gets us out of scary situations, or it pushes us to make sure that we meet certain deadlines. But sometimes stress can get to a certain level where it's not tolerable for us, or it's affecting our life in other ways. The same goes for depression. We might feel sad sometimes. We might feel down sometimes. And that's okay, and that's very normal. But sometimes that lingers, and it starts to also affect us physically, mentally, and it affects our relationships and also our health. Some signs to look out for depression are maybe you're eating too much and way more than you used to, or you're not eating at all and you have no appetite to eat. Maybe you're sleeping more, you're sleeping less. You find that you're isolating yourself a lot more. You find that you're feeling really, really guilty about things when you really shouldn't be. Or maybe you've lost pleasure in the typical things you found pleasurable in life. It's almost like I like to describe it as you've lost the color in life. It feels gray. If these symptoms persist, these could be signs of depression. They could be signs of something else, but I do recommend you talk to your family physician about it. It's really good to have that conversation. Some signs of anxiety that you might experience, they can present physically. Maybe we're biting our nails a lot more. We might be, shaking our leg a lot while we're just sitting there. You might be feeling headaches a lot more, palpitations. You might feel tunnel vision sometimes and have what we like to describe as panic symptoms. These are signs and symptoms of anxiety that also are a good reason to talk to your family physician about. But essentially at the end of the day, sometimes these symptoms can happen very, very transiently, maybe only for a day, and they go away and they never happen again. That's okay. But if these symptoms are lasting and they start to affect the rest of your life, it's definitely something you want to bring up with your family physician, because there's a lot of things we can do to address that. We can address it with medications, we can address it with counseling services, we can send you to the right people to have those conversations and start the right treatment plan. But you should not have to suffer alone. If you're ever having a crisis or having any thoughts to harm yourself or harm somebody else, there's a number you can call, 988. That's the National Suicide Hotline, and there's trained experts on there that can help you at any given moment.